Well, my name is Jason Belgopel, and I suffered from depression for about 10 years and just finishing up treatment for that. But my experience with the service providers was by and large very good. I started off with Family Doctor, who was good in getting me into a psychiatrist at the local hospital, which was very good. There was a crisis point in my life, and while it was handled very well, the doctor who was on duty that day, I think, made a bit of a courageous call and made the right call. And I was very pleased about that, and it was very helpful. But unfortunately, the looping back to my weekly psychiatrist didn't happen. And that meant when this happened on a Saturday, I didn't get scheduled to see her again until Thursday. And so practically an entire week went by without any follow-up. That was difficult for me and my family because it really would have been helpful to have somebody on the ground coming back to me saying, okay, we heard something happened. It was definitely like everybody was working in silos. I was working in a silo from my service provider in as much that we would talk on Thursdays, but I never got follow-up. And it ended up in a situation for my psychotherapist where I had been going for quite a number of months. Work got in the way one day, so I had to cancel, and that was fine with her. But I never immediately set another date, and she didn't loop back with me. She didn't call me back and say, okay, well, we couldn't make this Friday. How about another time? And it got away from me. You know, I just didn't call her back, not because I didn't want to, but it wasn't on the tip of my tongue. And that went on for months. And then it got harder and harder to get back looping in with her because there was a bit of a feeling that I had perhaps let down the relationship, which really I'm looking at now saying that's not the way I should have felt at all. I think the follow-up is important. A lot of doctors call you to make sure you're not going to miss the appointment. It'd be nice if they followed up after and said, okay, you had the appointment, now do you need another? Have you gotten the service you need? Did you connect with that psychiatrist? If you didn't, why not? This is important. Please come back, make another appointment. Let's do this now. I understand now that's more the way that the profession has practiced. At least in my mind, that's what they're doing. It's a situation where the patient has to reach out and seek the help. It's got to be a little more of a to and fro because not everybody has that ability to, say, okay, well, it's Friday, I'm going to call up my psychotherapist again and make another appointment. And I think the other thing is it's just, you're weak. You're very fragile when you're depressed. At least I was. I knew from my family that I was important, but the people who were there addressing these specific issues, I never got the feeling that, well, good, you're still here. This is a positive thing. Let me help you help yourself. Like Jerry Maguire said, or help me help you. That's what I needed. I went into my doctor some years ago, and I had a pain in my abdomen, and the doctor probed around, felt around, and thought, oh, this could be appendicitis. The treatment I got there, I found amazing. My doctor said, go right away to the hospital, you will be dealt with. I went right to the hospital. There was a doctor waiting for me because they thought that my appendix was going to burst. And they went and treated it, and it was not, and I was lucky. That's the kind of response they need for this part of your body. It's just as deadly a disease as any of the others, and it can happen so quickly. The other thing I think would have been helpful, and I know that's difficult, is to involve my family more. And I say it's difficult because I appreciate that doctors have a confidential relationship with the client, and the client is the focus. But life's not like that. I don't live all by myself. I live in conjunction with my family. The healthcare professional had said, this is what Jason needs. Even if it were offline from me talking to them, then it's a situation where it's between them and my parents, them and my wife. You can have your own discussion. What does Jason need? And it's not a situation of me imposing that requirement on you. It's a matter that you, the wife, you, the parents, have gotten that directly from the healthcare provider. You know it's not filtered through me. You know what Jason needs. And hopefully that will allow you to provide it without that barrier that I think, when I asked them, would have imposed upon them. And that would have been helpful because a lot of it was me coming back and saying, My wife would say, "So what did the doctor say today?" And a lot of the time at the beginning, my mind was just awash. It was swimming with what was happening to me and what was going on in the therapeutic relationship. And I wouldn't remember it all. I think for me, it would have been helpful if I had written things down. That certainly was something my therapist didn't like because it was more of a free association. They did suggest that I diarize when I got home. I mean, my psychotherapist said, "Oh, take notes if you want, but do it when you get home." I went to the psychotherapy, my psychiatrist, I went to her on the way to work, so I wasn't going to write it down at work and possibly have somebody see it there. So certainly when I got to the psychotherapy, I started writing things down and that was accepted there. And that really helped. I would go away from a session, I could look back and say, "Oh yes, this is what we talked about. This is the technique I'm supposed to practice." And when I started doing that, the improvement in myself was noticeable. Really noticeable, and I felt more in control. Not only that, but then my wife could better understand what was happening because I would come back and while I might have, just been swimming in what was going on, all the things we talked about, I could relate back to my notes and say, "Oh yes, this is an important topic we talked about and we should go for a walk every day," or whatever the issue was. I think there's two aspects to that. Absolutely right, writing it down caused me to have to think about it and think about what am I going to write down. And it involved me in the process in a way that if my therapist had written it down, it would have been that much more passive, and I don't think I would have connected with the written word as much. She was very good. She did sometimes photocopy articles or tables. A lot of it was tables and write your feelings down, etc. That never connected with me. And look back and see what I had done in the past weeks, and I could see improvement. Once you start seeing improvement, it really motivates, not that this is an issue of, I'm not motivated to improve, but it really energizes you to follow through with the course of treatment because you can see an improvement. I can't tell you how important it was to write things down.